Hello, I'm Dr. Tushar Parikh. I'm Chief Neonatologist and Pediatrician at Motherhood Hospital at Pune. Now, if you're thinking to take up pediatrics as your career option, then I would like to give you some important insights that I am practicing as a pediatrician since last 20 years. And these insights I've gained over last these 20 years, and I think they will be important for you when you think about pediatrics. So basically, pediatrics is a specialty of medicine where we deal with individuals less than 18 years. And I'm a neonatologist. Neonatology is a specialty of pediatrics which deals with babies less than 28 days. That is the first month of their life. Well, pediatrics is a very exciting specialty, believe me. As a pediatrician, the amount of satisfaction you get is extremely good. Now, when you consider pediatrics as your specialty, as an option for your career, some important aspects we need to remember. The first one is that basically you should love kids. You should be child at heart, because unless that is there, you will not be able to connect with your patients, with your kids, and you need to understand the child psychology well to understand what kid is going through. So once that is there, then you can consider taking up pediatrics as your career option. Second important thing is that a child is not a miniature adult. A child has a very specific requirements. A child differs with adult because a child grows and child has a developmental milestones which come up with time. So the child is not only growing in size, but child is also intellectually and mentally developing. And because of this, there are certain things which are very specific for child, and certain medications are allowed, certain medications are not allowed. The dosages are also not just half tablet or 1/4 of the adult dose. It is calculated per kilogram, and some medications are only acceptable if they are in that particular age category only. We have to also remember that the child cannot speak, and therefore you need to have a deeper and detailed knowledge of medicine when you consider pediatrics. There are considerations which are way beyond just the size of the child, and because the child is unable to express, the information which is there at your hand is very less. Also, when you are seeing these patients in your outpatient department, there is a scope that for you to have more creativity, because children like toys. Say, this is my pediatric OPD, we carry toys like this in the OPD, and they can be cartoons, and the OPD has to be child friendly. Your attire, there is a scope for you to be non-formal clothes you can wear, and that will help you connect with your kids. You should have age appropriate toys in your clinic, and this all will help to make the child more comfortable. When you're seeing the patients in outpatient clinic, you cannot just hurry them up. You have to be very patient, you have to be very gentle, and these kids, they require a lot of time sometimes to open up with you. But believe me, once they open up with you, they are very good friends with you, and your OPD is extremely enjoyable affair, and you will really enjoy conducting OPDs. Also, as a neonatologist, I always tell that when we manage to save a very critically sick newborn infant, we know that that child is going to develop into a nice human being, nice individual, and going to survive for 80, 90, 100 years. As against in any adult specialty, be it cardiology, be it oncology, you treat the patient and the patient will get survive for next 2, 5, 10 years and not maybe more than that. So that is one of the big things, that the number of the years we add into life is very high, and that is very gratifying. The newborn baby, when the baby is sick, baby is admitted in the NICU, is quite critical many times, but once they survive, we are able to pull them out of that critical stage, they really do well, and they are really, they develop into nice normal human beings, and that is really very satisfying. So if you are interested in taking up pediatrics as your career option, I will say go for it. It's a very satisfying branch, and you will really enjoy doing pediatrics and doing practice. All the best.